I think most people who deploy these grafts, who treat patients with aneurysms, of all the things that we have found most beneficial, this is it. And that's an earlier return to function. And that, to someone who's in their 70s and 80s, if they're fully recovered in a matter of a couple weeks as opposed to months, that can mean a huge difference to their quality of life in their future. And to me, that's probably the single biggest advantage of this. You might say, well, this sounds great. What are the drawbacks? Well, one of the drawbacks is that it is a new technology. And what the concern there is that this is a technology that has really been utilized just in the last couple of years. Again, the FDA just approved 2 devices in 1999. That's only a couple years. So we do not have decades worth of experience, nor does anyone, in terms of follow-up of patients. And there is always some caution when introducing new technologies as to what is really going to be the durability of the technology. As I suggested before, the old-fashioned operation is really a curative operation, and although, again, some folks can develop aneurysms elsewhere in their body above the graft or below it, the repair itself is really a curative repair. The Dacron does not degenerate, and once it's in place and the patient's recovered, it really cures this. And one of the things that we're learning about the stent grafts is, and everyone's learning about this, we are as well as surgeons around the world, is what's going to happen with these devices 5, 10, 15, 20 years from now. Our sense is that these devices in appropriately selected patients are going to hold up very well. And we're learning a lot about the technology. One of the obligations about this technology is that because there is some uncertainty as to how an individual is going to respond to this long term, one of our obligations and a patient's obligation is to follow up on this. In other words, after surgery, there are requirements for follow-up CAT scans down the road. I mentioned about the long-term data. The patient follow-up is more intense. After an old-fashioned operation, typically after one of my patients recover from this, I don't even do any further follow-up. I see no real advantage in following their aorta long-term, and I typically just see patients as needed in the future. With this technology, there is an obligation, and in fact the FDA has required us to follow patients after surgery, and typically we do that with CAT scans. In terms of the device itself, basically, again, the device looks very much like this. This